Hey everybody, and welcome to the Zero Suicide Initiative Philosophies of Care introduction video. My name's Adam Graham. Thank you so much for joining us, for engaging with this video content. You've probably already heard about the Zero Suicide Initiative, and to be sure, there's a lot that's going to be coming out about what it is and what services will be provided with the Zero Suicide Initiative. But for today, we want to take a moment to look at what's most important in how we provide care with the philosophies of care. So I'm joined by an incredible group today, and let them introduce themselves as they represent just a great range of voices and perspectives as we talk about this important subject matter today.
Hi, I'm Kayla Height. I'm a licensed professional counselor with Centerstone.
All right, I'm Shane Coleman. I'm the Chief Psychology Officer for Centerstone's Research Institute.
I'm Susan Seaborn. I'm a licensed clinical social worker and a clinic manager at Centerstone.
I am Paul D. Paul, a patient at Centerstone.
I'm Miracle Walker, and I am also a client at Centerstone.
So what I'd like for our time today is have Shane introduce a couple or one of the philosophies, and then open up to the group from your unique perspective and your voice to hear about the reflections you have on this, reactions you have to this, any examples that come to mind about this. Or if you want to speak to why you think this may be important in how Centerstone operates. I mean, we really would love to hear from you. Yeah, so these values of how we do care, not only is that being focused on the clients we serve, not just being focused on how we support each other, but also being focused on what's important about how we go forward. How do we grow? So specifically leaning into this measurement-based care and this suicide-specific treatment, these interpersonal drivers of suicide. And I'm curious from y'all's perspective of what you hear in that, how you respond to this kind of commitment from Centerstone.
So this last section is commitment to the future. And this is embodied by two separate areas. The first one being commitment to measurement-based care, and the second one, commitment to upstream interpersonal drive. It's really important as clinicians, especially in suicide prevention, that we're using measurement to not only better understand our clients from a suicide prevention perspective, but to also guide our care along the way of what worked, what is not working, where can I do a little bit better? How is this one aspect of your person, your emotions, your thoughts getting better? How is this getting worse? What can we do to tailor our treatment to get a little bit better? And that's, there's one aspect to clinicians, our clinical intuition that can help guide that. But this other aspect is measurement-based care, because we can't ask everything all the time. Our goal as clinicians, and really on us, to select the right assessment and then to interpret that assessment afterwards. That's really where a lot of specialty and expertise comes in to the measurement-based care space of suicide prevention. And this other piece of a focus on upstream interpersonal drivers of suicide. And over the last 15 years, suicide prevention care has gotten quite a bit different, right? So before the last 15 years, it was really a focus on treat the disorder, you'll treat the suicide. As someone's depressed, treat the depression, you'll treat suicide. You don't necessarily have to talk about suicide. Maybe you ask, maybe you don't. But over the last 15 years, that's changed quite a bit in mental health care, to where really focusing directly on suicidal thoughts, as well as focusing on those things that drive suicidal thoughts, the pain associated with disconnectedness with others, the pain associated with feeling like you're a burden on others. Really, these interpersonal drivers of suicide is really important for us to both measure, as well as to understand and treat directly with suicide-specific treatments in order to help prevent suicide, right? So these are really, really vital to us looking towards the future of suicide prevention.
I think measurement-based care has helped us to become much more proactive and less reactive when we think about suicide care. Like Shane was saying, 10 or 15 years ago, yeah, we were treating the disorder, but also we weren't really treating suicide. So now using measurements like the CSSRS that enables us to talk honestly about suicidal thoughts people may be having, it's also a way for us to help them and be proactive and plan and begin to intervene.
Absolutely. I think, like Susan was saying, being more proactive instead of reactive does make a huge difference. And that's what it was like in the past. And we have found that that is not effective. Sending someone to the hospital if they're experiencing a suicidal ideation is not what has been the most helpful or impactful to anyone. A lot of our clients fear that, and that has always been a barrier to people coming in and letting us know whether or not they're experiencing suicidal ideations, is that fear that they would go to the hospital.
I can speak to its identity in that, maybe like you were saying 10 years ago, that they would hospitalize you and wheel in an emergency cart, and I brought somebody to one of those. And seeing that on the other side, I knew I would never go for that help. I would never show up to that. I would never be a part of that. And it's taken, I don't know, all of the changes that you have made are obviously, better, because I would recommend people show up to this. I would keep coming back, keep doing it, keep trying. And it's vastly different than what that used to look like. I think it's a good change.
And even as we move forward into the future of zero suicide care, we want to move even further upstream to where we're identifying these interpersonal drivers and treating those that may or may not lead to suicidal thinking, but identifying those things that are much more likely to lead to suicidal thinking, to where we're preventing suicidal thinking from potentially even happening. That's my hope, is that we get to the point to where we are treating things early on, or we're able to prevent the pain associated with suicidal thinking, to where people may not even develop suicidal thoughts.
I agree. I mean, like, we go to the dentist every 6 months to get our teeth checked. We go to our PCPs.
We do.
Annually. In theory. But we go to our PCPs and we have our annual physicals. But mental health is an area that has a lot of stigma attached to it.
Yeah.
And with this whole initiative and this process, like you said, make it normal.
Mm-hmm.
Make the subject not be taboo. Like, this is something that we all deal with. It's not like back in, I don't want to say like what, they had like the asylums and somebody have a moment and you just ship them off and you never see them again. Like, it's normal. This is something that we all deal with. I should be able to speak on my mental health just as I would say, hey man, I got this really bad migraine today, I just can't deal.
Mm-hmm.
Yeah.
So I just appreciate that we have this program and that society is moving forward.
So well said. And so if we take these and put them together, then what I see is this vision of how we move into the future, where there is an intentional commitment to our clients, of one that the way we interact with those is going to be defined by honor and honesty and hope. That our commitment to each other is going to be intentional about carving out time in this approach of doing things together. And that we see a way forward into growth where we're not just going to stumble into the future, but we're going to say we're going to be intentional finding out what works and what doesn't. We're going to invest in measurement-based care and this upstream approach to suicide prevention. And what I hear when you put all these three things together, it creates an identity in the Centerstone community of this is who we want, what we want to be marked by. This is who we're going to be as we receive care, as we give care, that this is going to be our commitments through all of this. And so to wrap up, I'm just curious of any thoughts you guys have on this identity piece of what does it say to you about what it means to be the Centerstone community as one that's defined by a commitment to clients and each other and to the future.
I was just going to say I'm thankful and appreciative for the program as a whole, because it has not only helped out me personally, but my children as well.
I definitely appreciate being a part of this opportunity and, giving a face and a voice to this. It's all for the better.
I'm thankful for the training that I've received in evidence-based practices for suicide prevention, and I hope that Centerstone will continue to provide excellent trainings.
I'm just grateful for you all being here today, for your commitment to yourselves, commitment to others, and commitment to growth, and commitment to, continue to care.
All of that. And then I'll also say, like, I'm grateful for all of you guys, Miracle, Paul, like, all our group members and like individual clients that we serve. Like, I hope you know how much like we value our relationship with you. We learn from you, so we can go on and help the next person. So I'm really grateful for you.
And we get to see you guys help each other.
Yeah.
It's amazing.
We definitely feel it,
I'm so thankful for this great conversation that you've let us listen in on, just for the examples that you all set in the walks that you are walking out day by day. And thank you for your time in engaging with this. I hope it's been helpful, and I hope you have a great day.